Hey guys, it's Paul and welcome to my vlog. First of all, I would just like to greet my fellow nurses a happy International Nurses Day. So on this vlog, I will be sharing with you guys my tips and preparation on how to pass the NCLEX examination using just the 5 weeks schedule. Just a brief background first. So hello everyone, I graduated at the University of Santo Tomas with a Bachelor of Science degree in Nursing, last 2019. On the same year, I also took my Philippine Nurses Licensure Examination in the Philippines and became a registered nurse. And then on February 3, 2021, I took my NCLEX-RN examination in the state of Hawaii with my 5-week schedule and the materials that I am going to share with you guys. So let us begin. With this 5-week schedule of preparation, you have to strictly follow the schedule. On your first week of this 5-week schedule, you will just have to focus first on the concepts. Why the concepts? Because these concepts are your foundation in answering the Q&As. Your nursing concepts is really important for you to be able to answer the different levels of difficulty that NCLEX might be able to give you. Most especially on the basic principles and the basic concepts that they might be able to throw at you during your examination. So I will be mentioning the following materials that you could use to familiarize yourself with the concepts once again. First is the Simple Nursing YouTube account. Simple Nursing is a YouTube channel that talks about the different topics that you might encounter during your NCLEX examination. Simple Nursing YouTube account talks about the different medical surgical conditions, psychiatric conditions, and the like. What I like most about whenever I'm watching Simple Nursing YouTube videos is that at the end of their discussion, they always give you sample questions for you to analyze. And these questions are focused on the NCLEX style, which you can really use when answering the practice questions. Second source per concept is the Archer Review YouTube account. With their YouTube account, they will give you free discussions such as the prioritization and delegation, pediatric conditions, cardiac conditions, and even pharmacology. Among these topics that they have discussed, what I like most about is their discussion of the prioritization and delegation, which is the #1 focus of the NCLEX, since they are testing if you are a safe nurse. The third source per concept is the Mark Klimek audios. I think most of you have heard already about the Mark Klimek audios. It is also available on YouTube, but then for legal purposes, of course, you have to enroll, I think, in his class. But you know, we find ways. Now, fourth and my last source per concept is the Rachel Allen notes. With the Rachel Allen concept notes, you have to enroll in their program to be able to receive their notes. So I enrolled to their program last 2020, so it's been a year before I even took my examination. But then it's a good concept since it is concise and you can really use it for work. And even if you're done already with NCLEX, you can still browse these concepts whenever you're going to work if you need some refresher thing. You know, whenever you encounter different diseases, new diseases, something like that. And that's it for the concepts, guys. So for 1 week, you should be able to at least familiarize yourself with the diseases and basic concepts. You don't really have to memorize everything. You just have to familiarize yourself so that whenever you encounter that disease, you'll know what's in that disease, what are the signs and symptoms, management, and complications. Those are the 3 things that you really have to know. On your second and third week, it is now time to apply the concepts that you have learned on your first week. This time, you should be answering the La Charity, Prioritization, and Delegation book. I think they also have a soft copy of this one. Just search it online, it's available everywhere. Even if you just join a group on Facebook, you will find this one. Groups such as Archer Review, You World Review, all the groups wherein there are a lot of nurses helping each other. But then if you can't find it, just order online. In the Philippines, I think it's available with Shopee or Lazada. Just if you want a hard copy, you can just order there. I think I know someone who bought there. With the La Charity, Prioritization, and Delegation, you will only be answering that book until chapter 22. Why? Because after chapter 22, it will all be just case studies. And NCLEX is not like that. NCLEX is about simple and direct to the point questions, wherein they are gonna give you some basic questions, but then you are going to feel like, the fuck? Like that. So yeah, you will be answering that book for your second and third week. Make sure to answer at least 2 to 3 chapters per day. With the La Charity question bank, guys, if ever your scores are not that high, please don't lose hope. Because when I was answering that book, my scores was just average. And then sometimes I feel like I am just lucky to get a high score on certain chapters of the book. So whatever scores you will get, please don't focus on your scores and don't be so hard on yourselves. Please focus on the rationale. Your rationale is the most important part of your Q&A, aside from answering it. Because what's the point if ever you're getting a high score but then you do not understand the rationale of your answer? So during my Clarity Q&A practice, these are my 2 pages of papers. It's back to back, guys. You'll see the scores in here. It's just average scores. And then you'll see I have a lot of writing here on the sides. Since I really love to read the rationale, I'm telling you, do not focus on your scores. Just read the rationale, and then once you understand it, you'll see why the answer was like that. And now on your 4th and your 5th week of preparation, you should be answering the Archer NCLEX question bank. Now, why am I promoting the Archer NCLEX question bank? First of all, this is not sponsored, okay? I just want to help you. Because with this question bank, I got used on how to answer and analyze the NCLEX style questions. With Archer Review question bank, of course, it is not free. Nothing is free in this world. But it is the cheapest. I mean this, guys. It is the cheapest question bank that you will ever get. That has the assessment, the tutor mode, and now they have the CAT, the computer adaptive thing, just like in the NCLEX exam. So for Archer question bank, they have a subscription thing. So for 1 month, for 2 months, or for 6 months, if I'm not mistaken, I'll just show you here, guys. So after your subscription, you can now practice answering with the Archer Q bank. When I was using the Archer Q bank, I didn't use the tutor mode. I only used the assessment mode all throughout the 4th and 5th week. And just recently, they added a CAT button with your Archer account. A CAT is a computer adaptive test wherein it is like doing the NCLEX exam itself, wherein you will be assessed if you pass or fail, just like the NCLEX. But I can't talk so much about that since I didn't experience that firsthand, but then you will see it now if you subscribe to Archer. If you're the kind of person who is scared or does not really know yet on how to properly analyze the select all that apply questions, Archer is good for you, I swear. They're gonna give you a bunch of select all that apply questions in every assessment. How about the drag and drop procedures? Archer can also give you a lot of that in every assessment. So every day starting your 4th week, you should be able to answer at least 2 to 3 assessments per day. According to Archer, most of their students does not really perform well on their first few assessments, but then as you go further and as you take more tests, or at least have answered at least half of the Q bank already, you will start having a continuous high or very high scores. What I like most about the Archer assessment mode is that it is limited to 75 items. Meanwhile, in NCLEX, 75 items is the minimum score for them to decide if you ever pass or fail. Aside from they have a minimum of 75 items, it is also timed, meaning you will only be able to answer this one set of assessment in 2 hours. And after answering this one set of assessment, you will be able to see all the rationales and then your scores, which will be interpreted and compared against peer score. Now, what is the importance of your score compared to peer score? Your scores will be basically interpreted as low, borderline, high, or very high. They have a different classifications, but I don't know what is the specific number for that one. Now, you will receive these interpretations depending on your score compared to the peer score. The peer score is the average score of different students who already took the examination. And according to Archer, you should have at least 5 consecutive high or very high before you can be considered ready for the NCLEX examination. And just like what I said earlier regarding your scores with the charity book, it is like the same way with Archer. Please do not focus on your scores. Please focus on the rationale and on how to properly analyze every question, since every question is at equal importance. Being just a basic question or a basic topic does not mean that it won't hurt your exam. Remember that the more that you have a mistake in answering the basic questions, the more that your graph in the NCLEX goes down. You know what, guys? I have tried several question banks, but I'm not gonna name them. Some has too much concepts, some has too much informations, and some has a different format. Archer has a 1-day free trial. You may just try that one. After trying that one, you will see how NCLEX asked their question. I'm telling you, NCLEX has the same format as what Archer has. One more thing that I noticed with Archer Question Bank, whenever you look at the rationales, you'll see the references that I have. Most of the references are NCSBN, Saunders, Pilitary, name it. All the big NCLEX focused books and preparation things like that, they have it there. That's why whenever I want to argue with the answer, I just look at the sources and I will completely shut up whenever it's a reputable source. So when I was doing practice questions, specifically the assessment mode with the Archer, I was able to do 23 assessments, and these are my rationales. You see this, guys? It's back to back. That's how I did it when I was doing my review. So I used my La Charite Rationale and my Archer Rationale on my last 2 days prior to my examination, so that I am ready on whatever topic they will throw at me. And it worked. And that's it for your first week to 5th week preparation. Now let's do a summary of the things that I have mentioned. Again, for the review of your concepts, I highly recommend Simple Nursing Review on YouTube, Archer NCLEX Review on YouTube as well. And then if you want more concepts, you can try Mark Klimek audios, so that whenever you are bored or you're doing something else, you can just put an earphones on and then you can just listen. And another is Rachel Allen Notes. But of course, you have to pay for the class since it is a review program. And for the question bank, you don't need anything else. Just use these two and then you are good to go. First is the La Charity Prioritization and Delegation book until chapter 22 only, since after that one it's gonna be all case study. And then the second one is the Archer NCLEX Q bank. Please practice these two question banks for you to be familiarized on how the NCLEX asks their question and on how to analyze their questions properly. Now let's go for the tips. Tip number 1 is to study in a comfortable environment, a quiet environment hopefully, so that you can mimic how the environment is during your examination, since it's gonna be a totally quiet place. As in, you can literally hear the deep breathing exercises that your other co-examinees are doing, even though they're far away from you. Tip number 2 is not to overanalyze. Whenever they give you a certain question, just focus on that question. Do not think of like, what if like this? What if like that? Well, what's wrong with you? Well, if they didn't mention it, then it's not it. Next tip is, during your 5 weeks of preparation, please do not drink alcohol. I mean, even when I was in college, it is a general rule that whenever you are going to take an examination, most specifically a big examination like the board exam or anything that would be all or nothing kind of preparation, we have a belief in college that whenever you're drinking, you're not gonna be able to focus on that thing, and then you're not gonna be able to absorb all the things that you have studied because your neurons will be affected. Something like that. Next is what I've said like twice already, which is not to focus on your scores during your practice set. Please focus on the rationale and on analyzing every question and why the answer was like this, what did you miss, why was your answer wrong, and then understand and accept. Next tip is that even though you're just doing a practice set, please treat it as if it is already your NCLEX examination. In that way, you will get used to it and then you won't have any regret whatever scores you will receive whenever you're taking your practice sets. And lastly, believe in yourself. It doesn't matter if this is your first, your second, your third, or how many takes it has been already for you. Take it until you make it. You know, in the US, no one's gonna ask you if ever how many times you have took the examination already. And the number of takes that you took the examination does not say anything about your skills. You may have took the NCLEX examination a couple of times already, but then when you went to the area, when you are doing your duty already, you are the best. So just keep trying, keep believing in yourself, because you will make it just like us. And that's it, guys. Thank you so much for listening to this vlog. I hope you will find this informative and hopefully it can help you on your NCLEX-RN examination. I hope this 5-week schedule of preparation and the materials that I have mentioned will help you to be equipped with knowledge and the appropriate understanding regarding the concepts and on how to analyze the different questions of NCLEX, such as the select all that apply, the drag and drop, the basic question, even some computations. But don't dwell too much on the computations, they hardly even ask you that. I will also put the link of the different materials that I have mentioned at the description box, so please check that out. If you guys have any questions, clarifications, or recommendations, please don't hesitate to comment down below. And if you like this video guys, don't forget to click like, subscribe, and of course click the notification bell to keep you updated on my next vlogs. See you guys on my next vlog. Peace out. The voice.